We finally got the vaccine. The Covishield vaccine has been given approval from the subject expert committee, and right now there is a mammoth nationwide dry run of the vaccination that's underway. It's happening in 116 districts today in several states: Delhi, Maharashtra, Jammu and Kashmir, Punjab, Uttar Pradesh, Kerala, Tamil Nadu, Karnataka. You've got this dry run on besides several other states. The vaccination dry run has kicked off. A total of 96,000 vaccinators have been trained across the country. More than 57,000 participants at the district level. The states have essentially extended the bandwidth of helpline numbers. The vaccine delivery will be carried out as per the SOPs. And what you're seeing in this dry run is an elaborate arrangement of exactly what it will look like when the vaccine distribution, when the actual rollout happens. So from registration of every single person to also a jab being given and imitating really what the jab will look like, even to that very step, we are seeing this dry run being conducted, an observation center being set up where everyone who's been vaccinated will be required to sit for 30 minutes to be observed for any side effects. So those are the kind of steps that we're seeing really on the ground. I want to take this across to our reporters. We've got all of our reporters from across the country joining us. Before that, let's listen in to what some experts have to say. All right, Union Health Minister Dr. Harshvardhan is expected to shortly visit the GTB hospital in Delhi and personally monitor exactly what the dry run is looking like. I want to take this across to Ankit Tyagi. He's joining us live from Delhi. Ankit, good morning. It's over to you.
Thank you, Akshita. This is the GTB hospital, one of the largest COVID dedicated facility in the national capital. And behind me, you will see all preparations, in fact, being done for the dry run of the vaccine, of the administration of the vaccine as far as the people are concerned. 3 locations in the national capital, and GTB is one of those locations. The Health Minister of India, Dr. Harshvardhan, is expected any moment. He will review the situation. He will review the protocols which are being followed as far as this dry run is concerned. In fact, if you look at the entire plan of the government, initially it was done, the dry run for the vaccine was done in 4 states. And day after, Covishield has been given the emergency use approval by, in fact, the regulators, by the Health Ministry. Now, it will be the government rolling out the vaccine very soon. What we are hearing from our sources within the government is that it could possibly be in a week that the vaccine would be rolled out. And for that, now the preparations are on. This is going to be one of the biggest tests as far as the Indian health system is concerned. Though with universal immunization, pulse polio and other programs, the country more or less has experience of going to every corner, with such a vaccination program. As we speak right now, 9 to 5 is the time when this entire process, this entire dry run of the vaccination is going to take place. This time it is taking place all across the country. I'm also being joined by Asutosh, my colleague, who is joining us from Daryaganj, another location of this dry run. Nagarjun Dwarkanath is also joining us from Bengaluru. Nagarjun, I would just want to very quickly come to you, as now the preparations and this whole rollout plan, this is going to be a very important phase. What we learned today, what the health workers, what the administration learns today is going to make the vaccination process more robust.
Well, that is true. In fact, I just spoke to the Special Commissioner BBMP. He was speaking about the same thing, that how can the whole process be more robust. Right now, I'm coming from the vaccination room from one of the primary healthcare centers. So there's a vaccinator and there's also a desk where it checks the credentials of the health workers who come. There's a Covin app that has all the details of the health workers. You can see there is Rajaba, Manjula, Chaitra. These are the beneficiaries that have received the message from the department for the vaccination. And from this desk, then this is the counter where the vaccination is stored. This is the storage temperature book and the maintenance register. This is the box that will have all the vaccination. And to my right is the vaccinator himself who is sitting. He will speak to the beneficiaries here post the vaccination is done. And then all of them are sent to the observation room for, it's a 30-minute mandatory observation to be done here. as you can see, these are the health workers who have finished their vaccination dry run and now are waiting in the observation room. So the doctors are monitoring them for the time being. For the next 30 minutes, once the vaccination is done, they will be monitored, is what we are told. So it's a process that they wanted to check if the process is clean and also if the dry run process is it can go through seamlessly. And this is the waiting room before the vaccination is done. So this is also a room where health workers come and wait here before they get into the vaccination center. So they want to check that if the whole process is smooth, and the report will be given to both state government and central government by evening, is what we are told. 11 o'clock is the time when it ends. 25 persons from this west zone of Bengaluru have received messages from the Covin app to come here, get the vaccination done, and then the report will be submitted. So at this point of time, the whole process is still smooth, and some teething issues were there in the morning. Some didn't bring the Aadhaar card, some didn't bring some other document. So these are the elements that they would put out to the government at the end of the day.
Okay. Nagarjun, just giving us, an entire feel of how this entire vaccination process is going to take place. It's very interesting, what we are learning from our sources in the government. The vaccination is going to be voluntary. It's not mandatory, but the government has put out a very expansive protocol. The health workers first, then it will be the other frontline workers, that is the police, the paramilitary, and the other security forces, those who are involved in this entire process, the Safai Karamcharis and everybody else. And then it would be people above the age of 50, those who are going to get priority. But if you are less than 50 but have comorbidities or any serious ailment, you would also be considered for the first round of vaccination. The government is hoping that in the next 3 to 4 months, about 30 crore people would be vaccinated. Asutosh, as this dry run now rolls out, how is the Delhi government prepared, in fact, for this entire process? Because earlier we were speaking to Chief Minister Arvind Kejriwal, who said that about 2.3 crore people in the national capital, and the health minister and the government of Delhi were very confident that they would be able to vaccinate more or less everybody in 3 to 4 months.
And that's exactly how they started preparing for it, from ensuring cold storage to keep these vaccines safe from this dry run has been announced by the government. So here, since the dry run has already begun, so primarily the Delhi government has announced it will be provided to the frontline workers, the medical staff, Anganwadi workers, sanitization workers, and that's exactly how the process it has started here. As you rightly said, that India is experienced to deal with such mass scale of programming of immunization as we have done with the polio and several others. So these vaccines are since already available, and India has done those exercises. So that's not going to be really a challenging task. But this dry run is also to ensure the smooth and robust distribution. Such one center in central Delhi's Daryaganj, and this is how the Anganwadi workers, frontline workers in this holding arena sitting up after the due registration process is complete. Following that, they will be taken to inside, and we know that the vaccine is in form of injections, is injectable. Once the purchase agreement is done by the center government, that will be then.
Okay, Asutosh, I'm sorry I'm interrupting you here. Dr. Harshvardhan, the health minister, has arrived at one of the locations out of the 3 in the national capital, most likely the GTB hospital where we are standing and getting these visuals. I'm at gate number 3. Of course, him being the VIP has been taken inside from the gate number 1. But Dr. Harshvardhan has been a very hands-on person when it comes to this entire planning. He has been, in fact, making day-to-day updates as well. And as you see right now on these visuals, Dr. Harshvardhan is at one of the venue of this dry run where he is reviewing the entire process. Because for the health ministry, for smooth rollout of the vaccination, remember, at least at this point of time, and what we have learned from our sources, the vaccine which has been given the emergency use approval, that is the Covishield of the Oxford AstraZeneca Serum Institute. At this point of time, we know from Serum Institute that about 50 million doses, about 5 crore doses are ready. Remember, it will be 2-dose process, possibly in a gap of 28 days. So it will be very important to make sure that there are no pilferages, no wastage as far as this entire process goes. Because at least at this point of time, initially the number of doses could be very limited. The government would also have to take a call on how the various doses are procured and distributed among various states, because every state government would be extremely keen to get the maximum number of the vaccine doses so that they can start the process in their own states. Now, as we speak, ladies and gentlemen, Dr. Harshvardhan, who is in the national capital, he is in fact at GTB hospital taking a look at this entire process of the dry run which is going on. A hands-on review would be given to him. He would be able to in fact get a sense of what are the shortcomings, where are the gaps, and then of course it would be important for him to take this back and then go back to the drawing board and ensure that any plug, any loophole can be plugged before the actual vaccination process does start across the country. It is going to be a mammoth task, not an easy one. The transportation of the vaccine from the manufacturer to, in fact, making sure that it reaches to various spots. In fact, in the first phase, the part A of the first phase would, experts say, would slightly be easy because it will be only the health workers, those who are going to get the jab, and that would be done at very limited places like the hospitals that we are seeing today. But when you roll out part B, when the people over 50 years would start getting the vaccine, that's the time it will have to be done, possibly on a scale as we go through the elections in this country. So a very important, in fact, day for India, second day of the new year, first day beginning with the good news that Covishield has been given the emergency use approval, and now this entire dry run with more significance, with more vigor, becomes the most important event in the post-corona world for the country. Okay, let me now also from Delhi take you to Chennai, where Akshaya is joining us with more details. As the health minister here is reviewing the situation, Akshaya, what is the feedback? What's the process? What are the hiccups that we have seen so far in this entire dry run?
Ankit, I'm standing at the Rajiv Gandhi Government Hospital's dry run facility, and we're standing at the place, the center where the shots will be administered to people who are coming here. As you said, the healthcare workers are the first who will be administered, and currently today what we're seeing is in a batch of 5 people, we're going to see 25 such people being trained to see how the entire process happens, and these 25 people need to be completed in 2 hours. That is the aim with which the present situation is. Let me just show you how the entire situation is in Chennai. They have the co-vaccines stored inside boxes like these, and there will be nurses and doctors who will be standing here to ensure that each of these containers are opened safely and that the vaccines are taken out to administer. And these are incubation trays that have been kept here, and these will be used to also administer these shots. And from here they be taken to the observation room, and mandatory half-an-hour observation will be maintained in the center for every patient who comes in for getting these shots done. This is to ensure that the person who is getting the shot is safe and does not have any kind of symptoms or allergies that comes out of this vaccine. Till now, nothing of such has been mentioned, but still, on a safer side, they will be observed for half an hour mandatorily, and post that they will be taken, they will be allowed to go home. But in case there is any kind of allergies, they will be rushed immediately from here to the Rajiv Gandhi Hospital, which is an adjacent building. These are the kind of drills that are being followed here in Chennai and in other districts in Tamil Nadu. There are around 17 locations in the state of Tamil Nadu where the dry run will be followed, Ankit. And we can see that there are like physical examination rooms which have been kept in different locations within here. And these are also places where, this will ensure that each person who's coming in will have sufficient social distancing and also enough amount of time to compose themselves, because this is a new thing. And many people are also afraid as well as excited because, the afraid part is that they don't know how really this vaccine works. And the excitement is that things might return back to normalcy. So, Ankit, right now the Health Secretary is also monitoring every single center. Right now the Health Secretary is here in the center that I'm standing standing at also. We will be seeing what are the observations that he
Akshaya,
had, and we will be bringing you up to
May I
speed on
request
those
you?
details.
May I request you to stay on with me? Let's also bring in Gopi, who is tracking all the developments in Thiruvananthapuram. Big states, as Akshay was telling us, 17, in fact, dry run venues there in Tamil Nadu, in Kerala. How many dry run venues are there, Gopi? And how has the process been so far? The health minister herself was at one of the venues.
Well, Ankit, right now I'm in Thiruvananthapuram. I'm at one of the government hospitals here, and in this hospital, in this district specifically, there are actually 4 venues, including a private hospital where the dry run would happen. And just a while back, we had Health Minister K.K. Shailaja, who was supervising or who was monitoring the situation over here. And even before that, we had the district collector who came here to actually just monitor the dry run facility over here. Right now, I'm actually inside the dry run facility where I'm at the vaccination booth, if I can say more correctly. So these are the equipments that any person would actually encounter while he's administered with this vaccine dose. So this is the larger storage box of the vaccine. These are the kind of boxes in which the vaccines will be stored. And in this vaccination desk, you will see all sorts of things, including the syringe and the needle disposer. And all those things will be here inside a vaccination booth. And just a while back, we had the people who were actually here, who were identified as part of the dry run to be administered with the vaccine. And all those processes are now over. And even at this hospital now, I will just show you, there are 2 more larger facilities. You can actually imagine the kind of quantity of the vaccine that will be required for a state like Kerala. The total population is close to 3.5 crore. And even Chief Minister Pinarayi Vijayan has said that vaccines will be given to all the people in the state free of cost, which will certainly be dependent on the availability of the vaccines and as and when it is available. So the government here is also following a strategy similar to the central government. Initially, it will be the health workers, the doctors, nurses, Anganwadi workers, CDS workers who have been on the ground right from the beginning in the COVID containment activity. They will be the initial beneficiaries of this COVID-19 vaccine or Covaxin. And after that, there will be people identified based on their age and comorbidities, and they will be the people who will be in the second list of beneficiaries. And only after that, maybe the general public will get access to this COVID vaccine. So this is how the situation looks like in Thiruvananthapuram. And apart from the state capital, there are dry runs happening in Palakkad, Idukki and Wayanad districts of Kerala as well.
Right. Gopi, thanks for that latest update, a full roundup of what's happening in Kerala. This is the biggest story on the second day of the new year that we are tracking right now, the dry run. This is, ladies and gentlemen, make no mistake, very soon these dry runs are going to turn into the actual game. The vaccination process is going to start very, very soon. But the entire focus is on the Oxford AstraZeneca Serum Institute vaccine, Covishield. That has been given the approval for the emergency use, and that possibly is going to be the one which very soon would be at a vaccination point near you. What is this vaccine? How does it work? We have got exclusive access to that. Take a look at what goes into making Covishield and how effective is this vaccine, which has all the hopes of Indians lined up now.
It's the best New Year gift possible. A vaccine for COVID is here, finally. The Subject Expert Committee of the Central Drug Standard Control Organization has recommended emergency use of Covishield, the vaccine developed by Oxford University and AstraZeneca and manufactured here by the Serum Institute of India.
ये एक बहुत अच्छी खबर है क्योंकि अब हमारा नया अगला कदम शुरू होता है कि हम ये सारी वैक्सीन अपने देश में सब लोगों को कैसे लगाएंगे। जो प्रायोरिटाइज की हुई हैं उनका पूरा रोल आउट करने का जो चैलेंज है हमारे देश में वो अब शुरू होता है। और हम उम्मीद करते हैं कि जैसे ये वैक्सीन हमारे पास अप्रूव हुई है वैसे और जो वैक्सीन फाइनल स्टेज में हैं वो भी आ जाएंगी, जिससे नंबर ऑफ डोजेस बढ़ जाएंगे और हमें सब लोगों को वैक्सीन लगाने में काफी हद तक सहूलियत मिलेगी।
The decision comes just a couple of days after the UK regulator cleared the vaccine there. In the phase 3 trials, when 2 full doses were given, the efficacy was found to be 62%. The vaccine had shown 90% efficacy when half a dose is given the first time, taking overall efficacy to 70.4%. UK authorities say the vaccine has 80% efficacy if the second dose is given 3 months after the first one. The government plans to vaccinate 30 crore Indians by July. In the first phase, 1 crore health workers will get the shots. Then around 2 crore frontline workers will be covered. In the third phase, those above the age of 50 and people who have comorbidities will get the shots.
On India Today, we've been reporting how Covishield was the first running contender to get the emergency use authorization in India. Well, the time has come and just a few more days for India's vaccination drive to kickstart. With Himanshu Sharma, this is Milan Sharma for India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.